You're welcome to HMIS 1 Lesson 1. This is HMIS, that is to say, Health Management Information System. Health Management Information System. One of the amazing course unit recommended for the students or the scientists of the data in healthcare system. So it is amazing course unit, and probably I am pretty sure that you're going to enjoy and you're going to love it. Mind you, this is a core concepts in the professions of medical records. I repeat, this is a core concepts in the professions of medical records. Everything that we do, it is depends on HMIS. Yeah, we can talk about reporting of health information systems to the Ministry of Health. It is based on HMIS. So we are going to be talking about a lot of things that involves in HMIS, and of course, the course unit is divided into two, where we have HMIS 1 and then we have HMIS 2. So we are starting with HMS 1. When we are done in semester 2, that's when we shall discuss HMIS 2. So you need to be very, very attentive as far as this course unit is concerned. So how do we define HMIS? First of all, HMIS stand for Health Management Information System. So as a Minister of Health, you see, there is no way the facility, the government, in the sections of the Minister of Health can be able to do anything if they have poor reportings of the data from different facility, since the healthcare system of the country is decentralized. So probably it's very important to consider reporting of the information, not only reporting, but also collections and interpretation, and including presentation of this data to the stakeholders at a higher level of the Ministry of Health, so they can be able to plan for the facilities, they can be able to make decisions for the facilities. So, for example, those days we had COVID-19, which was really at high stake, and of course, there were things to do with daily updates of what has been happening, how many people were infected, and how many of them are, I mean, asymptomatics, how many of them have died, something like that. So the report, how were they, I mean, the ministry were informed through HMIS. So this is a very core concept in the management of the health system, and also the service delivery as far as health is concerned. So um, there is so many ways that we can be able to talk about HMIS, but of course we are going to start from here in part of the introduction. So HMS is a set of components and procedures organized with an objective of generating information which will improve the healthcare management decision at all levels of the health system in Uganda. We're talking about mainly things to do with Uganda. So components. A components is the consistence of varieties of sources, and we are talking about information and procedures that can be used, for example, in reporting, organizing, the information that has been generated from various health units, from various facilities in different regions, different districts, that is very necessary, and it is important in decision making at all levels of health system. So it means that decision making at the Minister of Health, as far as the health of the country is concerned, is based on the good management of health information system. So it is also a routine monitoring system that plays a scientific role in the monitoring and evaluation process. It is intended to provide warning signals through the use of indicators. So HMIS is something that is done daily. Data collection, for example, at the facility is done daily, and also we have some part of it which is done monthly. We have some part of it which is done quarterly. We have some part of it which is done annually. So this is something which is a routine monitoring system, something used in a daily basis in monitoring how things are going on in the facility so that the decision can be made at the end of the day. For example, when there is a outbreak in the facility or a medical records assistant is able to use the HMI system to report these kind of cases to the Minister of Health, and they can be able to take actions towards solving this problem. So it is very important. Right. So HMS forms the backbone of Uganda Health Sector Information System and is supported and reinforced by ICT. So information communication technology is what is taking HMIS to the higher level, and of course that is why these days we now have a system that we can be able to do the reporting right from wherever we are, and then we can be able to deliver the information where necessary. So and then IDSR, that stands for Integrated Disease Surveillance and Response. I repeat, IDSR stands for Integrated Disease Surveillance and Response. So it is a global standard which is used in monitoring the health indicators of the countries. So get to know that Uganda is doing bad as far as HIV infection is concerned. Kenya is doing bad as far as HIV infections is concerned. So they use the system in analyzing this. So like I said, HMIS is a backbone of the information, is the backbone of the healthcare system of the country. Now we have the framework of the HMIS. Yeah, so HMIS was developed within the framework of the following concepts. So the concepts of HMIS, one of them is what we're calling relevancy. Yeah, the information collected from various units, from various departments is recommended to be relevant to the policies and goals of the government of Uganda and responsibilities of the health professionals at all levels, especially at the level of collections. So when you're doing your collections at the facility, I know you may be a certificate student, where after this you will be working as a health record assistant. So most of the work you will be doing is data collections. So as you will be doing that, you must ensure that there is relevancy in every information that you collect. You must make sure that you don't have any information that doesn't have evidence. So things to do with the hypothesis is not considered in the case of data collections. Anything which doesn't have a base of evidence, you don't rely on it. So collect accurate information which is very relevant. You don't include something which is not necessary on the informations of HMS or medical records. And then the other concepts is functional. The information collected is functional. What do I mean by that? They must be able to make decision immediately. They must be able to be used immediately. They must be able to be put into actions immediately. So any information that you collect, it must be relevant, it must be accurate in a way that it can be used immediately so that the stakeholders can use them in decision making. So it is used immediately for management and not to wait for feedback from the higher levels. So this would be something that it can really give you decisions immediately. You don't need to be waiting for anyone to say anything before you can make decision, yet you are using HMIS data. That is very important. I hope we are together. Next is integration. Integration. Information collected is integrated. There is no set of forms and no duplication of reports. So when you talk of integration of reports, one of the things we are referring to is that the information is collected from all sources. Yes, and also the actions or processes of connecting all the information that you have from various locations, and then you present them to the higher stakeholders that they can use in decision making. Then another concept is that, sorry, um, so we have, I was talking about integration, so there is a word duplication of reports. Duplication of reports is where you have various reports of the same content, and of which it may either cause confusions, it may either cause misappropriations of resources. So report duplications must not be there, and it can only be resolved if the information is integrated. So then we have the most important concepts: routine. Information is collected on routine basis from every health unit. So what I mean by routine basis is daily. Yeah, collections of the data at the facility level is done daily. Yeah, collections of the information is done daily. Then reporting of the information is done weekly, is done monthly, is done quarterly, is done annually. I hope you get that clear. So there's a difference. There is collection and reporting. So you collect the information every day. Then at the end of the week, you process the weekly data and you report. Then at the end of the month, you process monthly information and report. And then at the half a year, that is around June, when people are actually presenting financial year, we also present quarterly HMS reports. Then we have the end of the year, that is annual reports. So it is done into 4 phases. But for collections, it is a routine activities. Data must be collected in a daily basis at health units, at health sub-district, at district within Uganda. It is done daily. So let's talk about goals of HMIS. Yeah, what are the goals of HMS? Yeah, so the major goal of HMS is to provide quality information to support decision making at all levels of healthcare system in Uganda. I repeat, providing quality information. Quality information. You know, uh, people make decision basing on quality information. So if you have poor informations, you will definitely make poor decisions. So you need, first of all, you need relevant information, you need functional information, you need integrated information, and then you need routine information so that you can be able to make decisions at all levels of health system. Even at home, you really need relevant information. If at all there is something you need to investigate, you make all round of monitoring, and then you can evaluate before you can really make decision in order to avoid errors. So another goal uh, is to establish and maintain a comprehensive source of routine health information for planning, implementation, and evaluation. That is what we call PA, PIE of the healthcare sector. Planning, it is something which must be done daily. Implementations of, for example, projects. You find the government is coming up and says, you know what, everyone need to do vaccination. because the information come and the HMS and said that we have a problem that we need to work on. Because if the ministry is notified that the area is having high rates of malaria infections, and that means the ministry must be able to do something. But how can they get to know? It is only through HMIS reporting and your daily data collection. All right, so we have mainly those two objectives. So let's talk about specific objectives. Specific objectives of HMS. One, provide quality information to support decision making in all health sector. Another one, to aid in setting performance targets at all levels of health service delivery. Setting performance targets. So, what could be the target? To you, you may have a daily target, that people have daily target, that people have monthly target, that people have weekly target, that people have monthly target, and I mean yearly target, and those who have quarterly target, and then we have those who don't have targets at all. What is your target? Maybe you're planning that by the end of after 2 years, you want to have your self-contained house in Kampala. You want to do this, you want to do that. That's your target. But the Minister of Health, they also have their target. For example, I will give you an example on the targets of stopping or combating HIVs. So HIV, the government is thinking that the Ministry of Health is thinking that by 2023, is it by 2030, HIV should be out of Uganda. Yeah, that's their target. I don't know how they're going to do that. But as part of the system, as part of the HMAS, we need to be supporting them with the relevant, accurate, and integrated information in a routine basis so that they can be able to make planning, decision, and all that. Look, medical records is the heart of the hospital. And the main objectives of the medical records is to ensure that the information is available, that is the facility is able to provide high quality services. So when you see this facility performing poorly, it can be judged based on the information that they use, because nobody make decision based on anything or what they have in their mind, but they make decision based on what you collect, what you file in the patient's records. So if you file poor information, what else do you expect? Facility will really have poor services. Then another thing is that to assist in assessing performance at all levels in the health sector. So performance, how are people doing? Are we making any progress in trying to maybe fight a disease? Are we making any change? Yeah. So even the jobs that the healthcare facility does, we have a form that every directors of the facility must sign every week, that is basing on the performance of every staff. So including you, when you join a system, then you start working and you perform poorly. Of course, the ministry will notify us, and definitely they will decide either to keep you in a system or to chase you out of the system. So performance of the health sector is very important, and it is verified, monitored, implemented, basing on the support that is rendered from health management information system. The next specific objective is that to encourage use of health information, encouraging the use of health information. People need to understand that when they go to the facility, they need to provide the personal information to the hospital, because as a hospital, we do understand the policy of confidentiality. We understand the concepts of the patient privacy. We understand the concept of the patient safety. So we will definitely make sure that the information are safe. So how do we make people to get used to this? When initially, when the medical records was still implemented, those days, there was a lot of error. People are making a lot of error within the health sector because of poor records management, that at the end of the day they need to use it in decision making, and yet they don't do that routinely, they don't program it well. So at the end of the day, you find that the facility is using what it can help them, so causing a lot of failures in terms of performance. Right. let's talk about HMIS design. Yeah, HMIS design. Why was HMIS designed? Why and how was it done? Number one, HMS was designed for use at all levels, whether it is L Center uh, 2, L Center 3, whether National Referral Hospital, regional, whatever it is, private and non-governmental, HMS was designed to be used at all levels. Two, official Ministry of Health reporting system replacing all pre-existing routine reporting instruction for programmers. Yeah, those days people used to report, you need to get a bus traveling to Kampala just to present your hospital report or maybe district HMS report. As long as you are the HMIS focal person. Yeah, but the coming of HMS replaces all the other old model of reporting, which was really affecting the performance of the health system at a higher level. The design of HMS brought the pleasures of amazing reporting system. Next thing is that HMS revised in line with HSSP2, that is a health sector strategic plan. Yeah, I think I don't have an editor. I would have write it for you. Okay, let me try to put this. So H, that is health sector uh, strategic plan. So that's what it stands for. Double SP. Health sector strategic plan 2. Those are the strategies that the Ministry of Health use in their planning. So they have health sector strategic plan 1, 2, 3. So when they plan for this and execute projects, that will be 1. And the next programming will be named 2, 3, 4, like that. So the other thing is that all districts have been trained in the revising of HMIS. You know, HMS is revised after some time, after, for example, 5 years. We shall talk about it in details. After every 5 years, it need to be revised. Things that are becoming updated, I mean, out of the system need to be removed, and those that still need fresh implementation, PA, they need to be put in place. So, as a result of that, HMS is being revised every 5 years. So I hyphenated and tried to define and break it down for you here. HMIS as per letter. So we have here health. What is health? I say health is state of a complete physical, mental, and social well-being of a person or community. That's how we define health. But of course, the World Health Organization, the recent update, we talked about physical, emotional, spiritual, social well-being of a person. So if you're free from anything, financially, physically, socially, you're able to do. When physically is that when you don't have any problems physically or like physical harm. Mentally, that's when you don't have any confusion of unable to make decision and think. Socially, it means being able to make friendship and keep them, and also be able to socialize and feel the pain of others. Yeah, the others that when you have a friend that uh, you lose a loved one and doesn't you don't you know it doesn't mourns with others. It simply means you have a problem socially. Yeah. So management, as it is, that is a process of working with and through people using other material resources to accomplish organization goals and objectives. That is how I define management. Informations are defined as data that have been shape into forms that is meaningful and useful to human beings. So, an information is different from data. Yeah, data is a raw fact, something that has not yet been processed, analyzed, and so forth. But information is something that can be used for decision making. It's already being processed. It is meaningful and also useful. And then we have system, a collections of interrelated components working together to achieve a common objectives or common goal. So just like the body consists of various systems, we have a digestive system, we have a circulatory systems. All those systems works towards achieving life in the human body. All right, so we have categories of HMIS. So we have informations on curative services. So we have information that we collect on patients that have conditions that can cure. We also have information that we collect about finance. And then we also have data on individual patients. Uh, we also have information on preventive services. We have some of these problems that they are really preventable. Yeah, people can prevent them, instead of thinking that you cure them. I think we have logistics and commodities. Yeah, for example, like drugs, basically hospital materials, items, and equipments. Those falls under logistics. We also collect data, and there is HMS data regarding that. Then we have resource management. For example, like inventories. It's also part of the HMIS data, right? So more definitions right here. Data, uh, a stream of raw facts representing events occurring in organization and arranged into a form that people can understand and use. Yeah. Process the conversion, manipulation, and analysis of raw inputs into a form that is more meaningful to humans. So what does it mean, processing? If you summarize all the informations, or let's say you convert the information of sex into figures. For example, in the register, if at all you have ever seen the register from the facility, and when you are reporting, you don't talk about the patients. You don't write patient's name, their age, the problem they've been having. No, you don't write that. What happens is that you will be reporting. So what you will do is, let me try to show you something right here. Take it from So let's say that we have here, let's say we have here, let's try to process information. Let me try to show you something briefly. So when you have patients, you may say that you will talk about a patient of age of as 0 to 28 days. Then you talk about 1 year to 5 years. Then you talk about 6 years to let's say 15 years. Then you also process the data of patients from 16 years to let's say 25 years. Then you also process information of patient from 30 years to, let's say, and above. Yeah, and above. So yeah, so this is what you do. So you just say that, all right, this patient, remember that you will have to divide them into you have to divide them into this. They must be divided into age, sex, and age groups. You understand? It must be like that. So we have this. I don't know whether you're able to see the table, but probably I'm trying to give you an example that you don't really need to do everything. That is processing. Yeah. So you go to your register and then you see that, okay, how many children that we have from age of 0 to 28. That maybe, okay, let's say we are talking about these are the patients of I forgot to say that. So this we are processing information of malaria uh, infection, uh, that is, let's say, weekly. Yeah. So let me try to make it bold a bit and bigger. Yeah. So we are processing malaria infection, uh, weekly malaria infection report. Okay. Yeah. Just trying to give you an example, so I don't want. I'm not bothered to make it accurate. Yeah. So we have here the 20 from 0 to 28 days. So how many of them? We shall count them from the register. We need to go the register. We see how many children from 0 to 8. Now this one we are going to maternity or labor. That's where the newborns are. Then we see that, okay, we have male. Okay, then we have female, right? Then this one also we have male. Then this also we have female. Okay, yeah, all of them will be like that. So we have here male, this also female, right? Then we have this, then we have male, then we also have female, right? Yeah, yeah, like that. So that this how it will be like, this how it will look. Let me try to adjust so that yeah, like that. So now male, how many of the male children at age 0 to 28 that were infected? Yeah, so this may be only two. This may be only two, and female maybe only maybe five. Yeah. Then from 1 to 5 years from our register, how many do we have? You count. Okay, you count them. You count all information, by the way, from your facility. The one that were born within that year. So the one of 1 year to 5 years, those are the patient that has been coming to your facility. So how many of them, male of them, that you have were reported of malaria? Yes, we have, for example, we have this. We have 10. I mean one. All right, no problem. Then female, we have 8. You get. So that's what we are doing. We don't write their names and like Emma, who and all that age what. Yeah, so we summarize them like this. That is what we call processing, data processing. And like this now you are able to present. You are able to present and says, yeah, last month malaria infections. Last week we had two females from the age of 0 to 28 days. We have 5 males of the same age of 0 to 28 days. Then we have one child of among males from the age of 1 to 5 years. Yeah, so that time will come and then we do more into details, definitely. But that is what I mean by processing. That's how you do your data processing. Then we have information system. Yeah, that is the interrelated components working together to collect, process, store, and disseminate information to support decision making, coordination, control, analysis, and visualization in an organization. So, one word I know it may be new to you is the word disseminate. The word disseminate is simply means spread, hmm? Spreading information or uh, sending, right? That is it. So information system, there's a component that are working together to make sure that information are collected, being processed, kept, and also spread, yeah, to people that need to use them, control, analyze, and visualize whatever it is. Visualizing, that is trying to predict the future of healthcare or whatever it is using the information system. So then we have feedback. Yeah, anything we talk about this in communication, anything that you present and you don't get a feedback, definitely it may not be a good thing. So output that is returned to the appropriate members of the organization to help them evaluate or correct input. Yeah, so if you give a feedback, yeah, then the person would understand that, okay, maybe I didn't do it well, and there is a problem here, and they are able to correct. Definitely. Then we have health sector strategic plan. Health sector strategic plan, it is of its own. It is an organs that stand into evaluating and monitoring of health sector, the performance of the health facilities, and how things are going on and being established at the facility level. Then we have sector-wide strategic plan that lasts for 5 years, used for monitoring the health sector towards the Millennium's Development Goal performance indicators. Probably this is the tactics that all the strategies use to monitor health global status within the country, like when it comes to issues with a pandemic, or maybe we have a problem in health that really needs an epidemiologist to get into the fields and generate informations and present the data. And of course, as a result of that, they will be able to update or reviewed HMS and says, okay, I think we don't need this, we don't need it, we need this, we need that. Right. So there's part of something here which is repeated. This part is repeated. I think that was a typing error. So, but what we need to look for is the use of HMS data. What do we use HMIS data for or a purpose? One, planning. Yeah, planning, deciding to do what to do, what we want to do, what is happening where there's infections, high rate of infection, measles, in let's say in sorority community. So what do? We need to put down the teams. We need to do this. We need to do that. We need finance planning. Yeah. The next ep- epidemic prediction. The term epidemic is widely or broadly used in descriptions of a disease, which is the outbreak. Yeah, the example is coronavirus is epidemic. So you can really use HMS data to predict the future as far as disease is concerned. Yeah, because if you see people there is no clean water in the area, people are drinking dirty water, what defecation is just anyhow, you can imagine, you just predict that you can use those HMS information and say, very soon there will be cholera in this area. It will be an outbreak. So definitely that will be a prediction. Then we have then we have epidemic detection. Yeah, predicting is trying to foresee the future using the information. Then detecting is realizing that, hey, we already have cholera. Wow. So how would you get to know? That's when you have a report from HMIS. Another thing is designing diseases a specific intervention. Now, when we have an outbreak, for example, like measles, what do we do? We need to make a plan. Yeah, where do we start from? Do we have vaccines? Do we need to do the vaccination? ABC. Yeah, that is designing the plan of intervening into either controlling, managing, and preventing a disease. Then we have monitoring work plan performance. So if the case is we have a disease designing diseases specific intervention, then it means now we need to monitor what are people doing. We said they need to do this and that, but they're doing it. We use the same HMS information, the report they are giving us. Basically, we use that, and then we shall be able to see and believe that the work plans is actually the way we planned. Then we have financing allocation formula. When you print your work, please correct that word. It's supposed to be formula, right? This uh, formula. So we use this information to finance the locations of, allocation of finance. When you want to know that, do we need 10 billion to in fighting of this disease? Do we need 5 million, something like that? We use that information to do the analysis. Another thing is health infrastructures development. Definitely, in data collections of HMS, we report even the amount of beds, hospital bed counting. Yeah, it's always done. That's why you see things to do with, like, we have 100 beds, we'll have 1,200, something like that. Yeah, it is because of the reports that come from HMS, and it will help them to see that, okay, because the number of beds is designed and implemented according to the rates of admissions within that facility. And then we have human resource deployments. For example, like workers, do we need 5 nurses in this facility? Do we need? It depends on the rates of workloads, and also the HMS reports how many workers are there, how many of them missing. Do we need to do this and that? So they use those information. Next is a focus support to some health units or individual personnel. Definitely. I think we have also drugs quantification. Drug quantification. So dispensions of drugs to different different facilities uh, where you find that other people are saying we don't have drug, we don't have this and that, but HMS is able to detect and provide such kind of services. So quantification is only a process of estimating quantities and cost of medicines and health products required for a specific period, and determining when a shipment of the product should be delivered to ensure an optimal and uninterrupted supply. Yeah, so those are the most important thing. So definitely, when next time we should talk about major sources of HMS data if we meet. But for today, we stop here. If you have a question, please drop it on WhatsApp or you send an email. But for those one who have WhatsApp group, please, whatever question you have, you will drop it on WhatsApp platforms, and I'll be able to address them right from there. Thank you very much.